Welcome back to Life in the Crapper with Zach. Now, as promised last week, I'm going to talk to you a little bit more about what exactly IBD is. So, what is IBD, you would ask? Well, thanks to sources such as Mayo Clinic, Wikipedia, WebMD, and my doctor at GI Consultants of Reno, we know that IBD is a set of conditions that affect the small intestine and the colon. Now, this isn't to be confused with IBS, Irritable Bowel Syndrome. Unlike IBD, IBS doesn't cause inflammation, ulcers, or any other kind of damage to the intestines. For this reason, it's referred to as a functional disorder because things look fine, they just don't work right. And also for this reason, it's considered less serious than something like IBD. But trust me, to those of you suffering from it, I know it's plenty serious. Symptoms of IBS can include things like crampy pain, bloating, mucus in the stool, and diarrhea. Some other names for IBS include spastic colon or spastic bowel. Now, unfortunately, we don't know what causes IBS or IBD. There are several popular theories out there that I'll discuss in a later video, but the underlying thing in all the theories that I think is important for anyone with this condition to understand is it's not your fault. Sometimes people get a disease and they go through guilt and shame, and it's just not something you need to put yourself through emotionally, because trust me, it's not anything you did, so just don't put yourself through that. Sadly, there's no real cure for IBD. Once you have it, you'll have it the rest of your life, but you may not always be experiencing symptoms of it. There is technically a cure for ulcerative colitis, which is removing the whole colon, because that removes the problem itself. But this is a last-ditch resort, and it's only something doctors jump to if the treatment hasn't been effective. And so the good thing to know is that the treatment out there can help people get to a normal state of being where they can lead healthy and functional lives. And so most of the treatment options out there, which I will get more specific about again in another video, really seek to control inflammation and other symptoms and get the disease into remission. This is what a lot of doctors refer to as disease modification, because a lot of people who have a form of IBD are at a higher risk of colon cancer later in life. But if you treat it earlier and get it into remission, or at least control the symptoms, then what it does is it effectively lowers the risk of getting cancer later in life because you have controlled the symptoms of the disease in the first place. So that's all really good news if you happen to have this. We'll talk a little bit more specifically about the two main types of IBD, which are ulcerative colitis and Crohn's disease. Now, there are a couple of other different kinds out there, but they're not very common, and sometimes doctors don't even consider them IBD for various reasons. So that's why we'll stick to UC and Crohn's. Now, the main difference between Crohn's disease and ulcerative colitis has to do with the nature of and location of the inflammatory changes that are taking place. Crohn's disease can affect any part of the gastrointestinal tract, all the way from the mouth to the anus, which means you could have healthy tract, healthy, Crohn's, healthy, Crohn's, healthy, Crohn's, healthy, Crohn's, you get the idea. Ulcerative colitis, on the other hand, tends to stick to the colon and the rectum. Now, another difference takes place on the microscopic level. Ulcerative colitis tends to affect the epithelial lining of the gut, whereas Crohn's disease can affect the whole bowel wall. Now, an example of this would be like if I took this big knife and I scratched up the wall in this bathroom. That would be like ulcerative colitis. Crohn's disease, on the other hand, would be like if I took this axe and started bashing holes all the way through the wall, started hacking the wall itself, and I created holes in the wall called fistulas. And then if I, as fecal matter, yes, I'm referring to myself as poop, would then have access to jump through the wall into other parts of the body And as you can tell, that's not very good. You don't want poop in other places where it's not supposed to be. Now, sometimes, such as in my case, because of the idiosyncrasies and how the disease presents itself, you may be diagnosed with indeterminate IBD. Now, that means they just can't tell, because what I had was a colonoscopy and a CT scan, and they found inflammation that was consistent with ulcerative colitis, but they also found small ulcers up near my terminal ileum, I don't know. And so those ulcers could be from nothing, or they could be from Crohn's disease. So it's one of those things that we may only be able to tell with time. Now, this is why it's important to not jump to removing your colon, because the similarities between the two diseases are so much the same. There are people out there who had their entire colons removed thinking they had ulcerative colitis, only to have symptoms reappear because it was actually Crohn's disease, which, as we learned, has the ability to skip around the digestive tract. So, it sucks. Okay, so I know this has been a really long video, so I'll just leave you with some of that information to chew over and digest. No pun intended. I really didn't plan that. Anyways, if you liked what you saw this week or you learned something new, please share my video with someone. Help spread awareness about this. But before you go, I want you to know I'm going to try and do something fun and different at the ending of the video each week. So this week we'll try a contest. I'll ask an IBD question, and the first one to email me the correct answer at lifeinthecrapper@gmail.com will win a copy of my favorite video game of all time, The Legend of Zelda: Ocarina of Time on the Nintendo 3DS. So, here is the question. What is the abbreviation of the bacterium that affects ruminants, which could possibly be linked to Crohn's disease? Do something nice and good for someone this week. I'll see you later.